My doctor photographed my symptoms for medical records until I learned where those images were really going. Dr. Nathan Aldridge took the first photograph during my initial consultation at Riverside Dermatology when I was 19 years old. I'd come in for a persistent rash on my lower back that wouldn't respond to over-the-counter treatments. He explained that medical photography was standard practice for tracking skin conditions over time, for comparing treatment effectiveness, and for consultation with specialists if necessary. The explanation made perfect sense. Dermatology was a visual specialty. Of course, they needed photographic documentation. He positioned me standing against a white backdrop wall, had me lift my shirt just enough to expose the affected area, and snapped 3 photos with a professional medical camera, clinical and professional. Nothing about the interaction felt inappropriate. He prescribed a topical steroid and scheduled a follow-up for 2 weeks later. The rash improved slightly but didn't fully resolve, which Dr. Aldridge said was normal for chronic dermatitis. He took more photos during that second visit, explaining he wanted to document the treatment response for my permanent medical file. Again, perfectly reasonable. I was a college sophomore studying biology with plans for medical school. I understood the importance of thorough documentation. My mother had been seeing Dr. Aldridge for years for her rosacea and recommended him enthusiastically. He was board certified, well-respected in the community, had a busy practice with a 6-week wait for new patients. Everything about him screamed legitimate, competent, trustworthy physician. The rash spread over the next month, appearing on my thighs and upper arms in patches that itched intensely and sometimes cracked and bled. Dr. Aldridge ordered blood work to rule out autoimmune conditions and took more extensive photographs during each visit. He had me change into a medical gown that exposed the affected areas while keeping other parts covered. A nurse was always present during the photography sessions, which reinforced the clinical nature of the process. He'd narrate what he was documenting as he took each shot, explaining angles and lighting choices that would best capture the inflammation patterns. His professionalism was impeccable. He never touched me unnecessarily, maintained appropriate eye contact, and treated me with the kind of respectful concern I'd expect from a quality physician. When the blood work came back showing elevated inflammatory markers, he diagnosed me with a form of chronic dermatitis that would require long-term management and careful monitoring. He explained that my case was somewhat unusual in its presentation and severity for someone my age, which meant thorough documentation would be valuable for tracking progression and treatment response. I felt grateful to have a doctor who was so meticulous about my care, rather than dismissing my symptoms as minor. Over 6 months, the condition worsened despite multiple treatment attempts. Dr. Aldridge tried various topical steroids, immunosuppressants, and antihistamines. Nothing provided lasting relief. The rash now covered significant portions of my torso, arms, and legs. The photography sessions became more frequent and comprehensive. He'd document not just the active rash areas, but also the surrounding skin to show the contrast between affected and unaffected tissue. He explained this comparison photography was essential for measuring spread patterns and treatment efficacy. During one appointment, he asked me to remove my bra so he could photograph the rash that had appeared along my ribcage and the underside of my breasts. The nurse was present, and he explained that partial views wouldn't capture the full extent of the inflammation. I hesitated but complied because refusing seemed irrational. This was medical care. Bodies weren't sexual in clinical contexts. My discomfort felt immature, a holdover from adolescent body shame that I needed to overcome if I wanted to be a physician myself someday. He took the photos efficiently and professionally, gave me a new prescription, and moved on to discussing dietary changes that might help reduce inflammation. Nothing about his demeanor suggested anything inappropriate. The breakthrough moment that changed everything happened in a coffee shop 8 months into my treatment. That's when I made the biggest mistake of my life. To see the full story, click the link below or go on my channel.